Trauma-Informed Care in Nursing Homes video series, Video 5, Cultural, Historical, and Gender Issues. Welcome to our Trauma-Informed Care video series for nursing home staff. Today we'll be talking about the trauma-informed care principle of cultural, historical, and gender issues. In this video, I'm going to talk about how trauma-informed care requires that nursing home staff understand the ways that cultural, gender, and historical contexts can shape how someone has experienced trauma, their reactions to it, and how staff can respond in a more trauma-informed way. Cultural competence is a willingness to acknowledge and understand the different backgrounds people bring into the setting and how those backgrounds have influenced their life experiences and their worldview. In nursing homes, there's often an age difference between residents and workers, which can create differences in life experiences and worldviews. Cultural competence can help. Simply put, cultural competence is understanding differences. You may be asking, why is cultural competence important for the implementation of trauma-informed care in your nursing home setting? It's critical that we use a person-centered approach to caregiving, and in doing so, we allow for the fact that people bring their history and their background with them. One's personal identity influences how they experience the world. The opportunities or disadvantages they've had access to across their life can be influenced by things like language, gender, and the city in which they live, just to name a few. Another example of this could be education. Education can increase chances of success in life, but is influenced by other factors. Homes in areas with higher property values pay higher taxes, which then feed into schools with greater resources, which then allows those students to have more opportunities. Gender has played into this over time. Even in areas with well-resourced schools, they only provide value to those who attend. In the 1930s, my own grandmother had to leave school after 8th grade to go to work because her parents thought there was more to gain by her brothers finishing high school. While a girl might not leave school today to provide opportunities to her brothers, the older adults you work with in nursing homes have had varied opportunities in education, in careers, and so on, because of who they are and when and where they lived. So how can you create an environment where residents believe that their background will be understood and people will listen to their perspective? First, all need to respect and understand diverse backgrounds. Other videos discuss how the experience of trauma is specific to each person. In addition, people from different cultural backgrounds may have unique experiences and perceptions of trauma. So one person's response to a situation may provoke a different response than their neighbor. For example, language matters. A Native American elder may negatively perceive being called Indian. This term is no longer an appropriate ethnic descriptor. However, because of its historical use in the United States, this may prove challenging to change for non-Native older adults. It's important for staff to understand that this term can be a problem and to address it if it gets used. This problem could exist across multiple identity groups, and the best way to find out which term an individual with an identity different than yours prefers is to ask the person or their family member if the resident is unable to share themselves. We also need to avoid stereotypes and biases that may be present between workers and residents and between residents. A cultural competence lens helps staff avoid making assumptions or perpetuating stereotypes about individuals from backgrounds that are different from their own. This is important because implicit biases can produce obstacles to effective communication and care delivery and can actually re-traumatize. The important message here is don't assume, ask, and be willing to work with the resident and or their family to find an acceptable solution. Trust is a critical component of trauma-informed care. Residents who trust their care providers are more likely to engage with care. Cultural competence makes it easier for residents to trust staff. Are you someone who demonstrates respect for your residents' cultural identity? Trust is beneficial for you and the resident. It enriches the provider-resident relationship, leading to better treatment outcomes for the residents and positive quality of work experiences for you. We also need to provide culturally sensitive treatment. Trauma-informed care should be patient-centered and have the unique needs and preferences of the resident in mind. Culturally sensitive, trauma-informed treatment considers cultural norms about gender relationship, religious practices, physical touch, eye contact, clothing preferences, food, healthcare preferences, and so on. Incorporating a culturally competent lens enables care providers to shape treatment plans and interventions that keep in mind the cultural background, identity, such as race, ethnicity, gender, socioeconomic status, religion, and so on, and personal values of the resident. Here are some ways we can operate through a cultural competence lens. We can promote inclusivity. Trauma-informed care is about creating a safe and inclusive environment for both residents and staff, especially when residents and staff come from different backgrounds. Cultural competence is a key component of inclusivity, ensuring that care providers and support systems respect and value diversity in all aspects of their practice. When individuals from diverse backgrounds feel understood and respected, they're more likely to seek help when needed. For example, does the physical space include depictions or reflections of various cultural representation, for example, art or furniture? This inclusivity should apply to both staff and residents. The nursing home's culture should be open and inviting to all, demonstrating overtly that all staff and residents are recognized and celebrated. While nursing homes cannot force people to accept those that are different from them, they can promote a culture of acceptance and call out discriminatory behavior. It's not possible to take a zero tolerance policy, like in schools, then the organization needs to find a way to create a safe space for those who might feel victimized, such as opportunities to call out the behavior without fear of being reprimanded, time for open dialogue, maybe allowing a staff member to take a mental health break after dealing with a difficult resident, or switching a resident known to be discriminatory off someone's assignment altogether. We can recognize cultural barriers. Culturally competent trauma-informed care doesn't lead with a Western medical lens of diagnosis and caring or curing, but instead encourages care providers to acknowledge and address cultural barriers to healing and recovery. It comes from an understanding that residents may have experienced a cultural stigma in the past during care situations, and that by incorporating and respecting traditional healing practices of residents and acknowledging the role of family and community in the process, the nursing home has the opportunity to break the cycle. We can create cultural safety. Cultural competence is closely related to the concept of cultural safety, which involves ensuring that individuals feel safe and comfortable in the environment. By demonstrating cultural competence, care providers can create a culturally safe space for individuals to share their traumatic experiences and seek help. For example, positive communication is essential. Understanding the cultural nuances in language and the verbal and nonverbal communication styles used in different cultures can improve the resident-provider relationship by ensuring that information is accurately conveyed and understood. An inclusive, culturally competent environment is essential in trauma-informed care because it promotes respect, trust, and facilitates positive communication and interactions. It also acknowledges that culture may create specific treatment needs for residents. A culturally competent environment ensures that care is sensitive to the cultural background of the resident, promoting care delivery that empowers and supports residents from diverse backgrounds. In conclusion, cultural competence is not one action, but an overall attitude of respect and acceptance towards individuals who are different than you. It involves learning what you can about others' cultures, but also being open to hearing from them about meanings within their culture. When done well, cultural competence leads to greater trust between staff and residents, better relationships, and better outcomes.